Coronavirus disease COVID 19 Q&A. What is COVID 19? COVID 19 is the infectious disease caused by the coronavirus SARS-CoV-2, which is a respiratory pathogen. WHO first learned of this new virus from cases in Wuhan, People's Republic of China on 31st December 2019. What are the symptoms of COVID 19? The most common symptoms of COVID 19 are fever, dry cough, fatigue. Other symptoms that are less common and may affect some patients include loss of taste or smell, nasal congestion, conjunctivitis, also known as red eyes, sore throat, headache, muscles or joint pain, different types of skin rash, nausea or vomiting, diarrhea, chills or dizziness. Symptoms are usually mild. Some people become infected but only have very mild symptoms or none at all. Symptoms of severe COVID 19 disease include shortness of breath, loss of appetite, confusion, persistent pain or pressure in the chest, high temperature above 38 degrees Celsius. Other less common symptoms are irritability, confusion, reduced consciousness, sometimes associated with seizures, anxiety, depression, sleep disorders. More severe and rare neurological complications such as strokes, brain inflammation, delirium, and damage. People of all ages who experience fever and or cough associated with difficulty breathing or shortness of breath, chest pain or pressure or loss of speech or movement should seek medical care immediately. If possible, call your healthcare provider, hotline or health facility first so you can be directed to the right clinic. How can we protect others and ourselves if we don't know who is infected? Stay safe by taking some simple precautions such as physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning your hands, and coughing into a bent elbow or tissue. Check local advice where you live and work. Do it all. When should I get to test for COVID 19? Anyone with symptoms should be tested wherever possible. People who do not have symptoms but have had close contact with someone who is or may be infected may also consider testing check with your local health guidelines. While a person is waiting for test results, they should remain isolated from others. The testing capacity is limited. Tests should first be done for those at higher risk of infection, such as health workers, and those at high risk of severe illness, such as older people, especially those living in seniors residence or long-term care facilities. Is there a vaccine for COVID 19? Not yet. Many potential vaccines for COVID 19 are being studied, and several large clinical trials may report results later this year. If a vaccine is proven safe and effective, it must be approved by national regulators, manufactured, and distributed. WHO is working with partners around the world to help coordinate key steps in this process. WHO is working through the ACT Accelerator to facilitate equitable access to a safe and effective vaccine for the billions of people who will need it once it is available. Are antibiotics effective in preventing or treating COVID 19? Antibiotics do not work against viruses. They only work on bacterial infections. COVID 19 is caused by a virus, so antibiotics do not work. Antibiotics should not be used as a mean of prevention or treatment of COVID 19. In hospitals, physicians will sometimes use antibiotics to prevent or treat secondary bacterial infections, which can be a complication of COVID 19 in severely ill patients. They should only be used as directed by a physician to treat a bacterial infection